Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by LucidQuest, a groundbreaking dietary shift could lower the risk of multiple myeloma. In the Nutrivention trials, a whole food, high-fiber plant-based diet improved insulin resistance, reduced inflammation, and increased gut microbiome diversity in high-risk patients. Participants boosted their plant-based intake from 20% to 91%, achieving an average 6.6% BMI reduction. Ongoing trials, Nutrivention 2, 3, and 5, are exploring supplement strategies and applications in newly diagnosed patients. Exercise plays a powerful role in colon cancer outcomes. The Challenge trial showed that structured physical activity, including brisk walking, led to a 28% reduction in cancer recurrence and a 37% drop in all-cause mortality. Conducted over nearly 8 years with 889 patients, the 5-year disease-free survival rate was 80.3% for the exercise group, compared to 73.9% for controls. These findings reinforce the need to integrate physical activity into standard cancer care. Restrictive diets may have unintended mental health effects. A BMJ study analyzing U.S. nannies data found that low-calorie, nutrient-poor diets were associated with higher depression scores, especially in overweight men. Participants on restrictive diets scored up to 0.61 points higher on the PHQ-9 depression scale. Nutrient deficiencies, stress, and weight cycling are among the suspected causes. Experts advise against extreme restriction and emphasize the value of balanced, sustainable nutrition. A novel strategy is turning mosquito biology against malaria. Genetically modified Metarhizium fungus is being transmitted sexually by male mosquitoes to females, killing 90% of them while leaving the males unharmed. Field trials in Burkina Faso show the fungus also enhances mosquito sensitivity to insecticides. This approach could become a powerful tool in the fight against malaria. In weight loss science, Tirzepatide is outperforming semaglutide. According to the SURMOUNT-5 trial, patients using Tirzepatide lost an average of 20.2% of their body weight, compared to 13.7% with semaglutide. Tirzepatide's dual hormone action, targeting both GLP-1 and GIP receptors, may explain the edge. Side effects were similar for both drugs, with nausea affecting 44% and abdominal pain 25% of users. While promising, the trial was funded by Eli Lilly and was not blinded. Concerns rise as the bird flu virus shows resilience in raw milk. The H5N1 strain remained viable for more than 24 hours at room temperature and over a week under refrigeration. This raises public health alarms given growing raw milk consumption. The virus has already infected over 1,000 cattle herds and several dairy workers in the United States. Pasteurization effectively eliminates the virus, underscoring the critical need for safe milk processing. New evidence highlights the protective role of gut bacteria in infants. The presence of Bifidobacterium longum in 1-week-old babies, particularly those born vaginally, was linked to a 50% reduction in hospitalizations due to respiratory infections. The bacterium helps develop early immunity by digesting components of breast milk. This study supports targeted probiotic interventions rather than controversial methods like vaginal seeding. Finally, a tech breakthrough led by youth. 14-year-old Siddharth Nandiala has developed Circadian AI, a mobile app that detects signs of heart disease in seconds using only a phone's microphone. With 96% accuracy, the app analyzes heart sounds to identify irregular rhythms and early signs of heart failure. It has already been tested on over 18,000 patients and is now available for clinical use. This innovation may significantly expand access to early cardiac screening, particularly in underserved areas. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.